Dr. Baliga here. I have another terrific podcast for you, the Must Know EKG podcast. You'll find this podcast educational, like all other podcasts in this Must Know EKG series. This podcast is derived from EKGs available at mastermedfacts.com. A 47-year-old homemaker complains of lightheadedness and shortness of breath. She is seen by a primary care physician who does an EKG in the office. This EKG shows A. Type 2 Morbid's heart block, B. Venky back heart block below the bundle of his, C. Complete heart block above the bundle of his, D. Complete heart block at the bundle of his, or complete heart block below the bundle of his. And the correct answer is choice 3, complete heart block above the bundle of his. In complete heart block, there is no atrioventricular conduction. The ventricular escape mechanism can occur anywhere in the atrioventricular node to the bundle branch Purkinje system. The narrow Qrs complex in this case suggests the block is above the bundle of his. The EKG in complete heart block can be divided into two groups. The first, those with very slow ventricular rates and widened Qrs complex, and this group is more likely to have Stokes Adams attacks. The wide Qrs complex suggests that the heart block is at or below the bundle of his. Those have normal Qrs complex and fast ventricular rate, that is usually over 40 beats per minute, is the second category. The narrow Qrs complex suggests that the heart block is usually above the bundle of his. EKG features of complete heart block include regular PP interval, regular RR interval, lack of an apparent relationship between the P waves and the Qrs complexes, and more P waves are present than Qrs complexes. Stokes Adams attack, what does it refer to? It refers to syncope or fits occurring during complete heart block. It was described by two Irish physicians, William Stokes, Regis Professor of Medicine in Dublin, who graduated from Edinburgh, Scotland, and Robert Adams, Professor of Surgery in Dublin, was an authority on gout and arthritis. The first description of the syndrome has been attributed to Marko Gerbak, a physician of Slovene descent, who is believed to have published it in 1717. He was a native of Carnolia, which is present in present-day Slovenia, and Carnolia has got Upper Carnolia, Lower Carnolia, and Inner Carnolia. This map is from Wikipedia. What are the different types of heart block? First degree heart block is where the PR interval is greater than 0.2 seconds. Every P wave is followed by a Qrs complex. Second degree heart blocks are three types: Morbid's type 1 or Venky back, where there's progressive lengthening of PR interval and shortening our RR interval until a P wave is blocked. The PR interval after the block beat is shorter than the preceding QR interval. The second strip is second degree heart block, Morbid's type 1. The third strip is second degree AV block, Morbid's type 2, where there are intermittently blocked P waves. The PR interval is on conducted beats is constant. This patient has a conduction ratio of 2:1. The fourth strip is second degree or high grade AV block. The conduction ratio in this instance is 3:1, but in high grade AV blocks the conduction ratio is 3:1 or more. The PR interval of the conducted beat is constant. In this strip, which is the fourth strip from top, there are two P waves before the QRS, and the third one is buried in the preceding T wave. And the final strip, or the bottommost strip, shows a third-degree AV block, where dissociation of atrial and ventricular activity. The atrial rate is faster than the ventricular rate, which is of junctional or ventricular origin. This concludes this Must Know EKG podcast. Follow me on Twitter at RR Baliga MD.